awake BBL. People doing BBLs, just sedation with Valium, local anesthetic only, not taking into a full-blown operating room, doing it in an office-based surgery center or just in their office. And some patients are looking for this, number one, because it costs less, as you would imagine, because there's no facility or at least no anesthesia fee. Some patients are talking about having decreased time for recovery and just being less scared of the process because they're kind of there for the whole thing. What are your thoughts on this?
I would never do this. The more I think about, how I've been doing BBLs even under anesthesia over the last year, I'm always using ultrasound. And so I'm very careful. Every ounce of fat that I inject, I do put it deep, but I go above the fascia. I think when we think of the dangers of it, like why would we want to do it under full anesthesia? You have to ask yourself, and then why would we be okay doing it awake? So in my opinion, I think awake, it can be dangerous because the amount of lidocaine and tumescent you have to put into the patient to get enough fat to be able to inject in the butt, right? So I think that's one of the main concerns. And so you run into problems like lidocaine toxicity, patient not being numb, not being comfortable. You can sedate them, but that doesn't mean that they're not getting lidocaine overload, right? And then secondly is if you're doing it awake, are you putting it in the right layers of tissue? Now, if you can if you can make sure you don't give them too much lidocaine and they're comfortable, and you can put it in a layer of the butt that they tolerate and it's not the muscle, that's why I would say I may do it actually. And I feel very comfortable doing it awake, but I don't think it's the safest thing to be doing these for patients in those high volumes.